Okay, good day everyone. My name is Mr. Prosper. I know it's been a while that I dropped content here. I'm very sorry. But I already said that my content are based on the question that my students are asking me, or the people that are around me, the type of question they are asking me. So recently I've been getting a lot of questions concerning a particular topic about ulcer. So today I'll be talking about ulcer and its implication. I'll be talking about ulcer and its what implication. A lot of people have a lot of misconception about ulcer, about the effect, about what causes it. So today I'll just guide you through the peripheral, about the simple terms, the simple things you need to know about the term ulcer. So let's start. What is ulcer? Like somebody asks you are suffering from ulcer. What is ulcer? Ulcer, simply put, it's just a sore on the lining of the digestive tract. When I mean sore, I mean injury that occurs on the lining of the digestive tract. So the lining I'm talking about is anywhere food passes through, from your mouth to the esophagus, to the pancreas, duodenum, stomach, small intestine, large intestine, down to your anus. So these are the linings. So any injury that occurs in any of this lining is what we are referring to as what? Ulcer. It usually leads to pain, a discomfort, and as well bleeding. So that is basically what ulcer is. And then we all have different type of it. We have different type of ulcer. So depending on where the ulcer is occurring. For instance, we have one type of ulcer. We have gastric ulcer that usually occur in the mouth. We have gastric ulcer that occurs in the mouth. Then we also have the duodenal ulcer. Duodenal ulcer, according to the name, occur in the duodenum, the lower part of the intestine, the lower part of the small intestine. Then we also have the peptic ulcer. Peptic ulcer is the general term, or a combination of the gastric ulcer and the duodenal ulcer. Then we have stress ulcer. Ulcer that is brought about as a result of being sick or ill over a long period of time. So it's usually common among patients in the hospital, people who are bedridden for a long time. Then we have what I call induced ulcer, meaning it is induced as a result of what you are taking in. So we have some drugs, especially non-steroid drugs. Okay, let me put it this way. We have non-steroidal anti-inflammatory drugs. Yeah, these are the type of drugs that bring about this type of induced ulcer. So basically, these 5 ulcers are what a lot of people suffer from. Now, let me put you through what do you think are the causes of ulcer? What are the causes of ulcer? We have a lot of causes of ulcer. Ulcer can be caused by infection. It can be caused by overuse of a particular drug, like I said, and non-steroidal anti-inflammatory drugs can cause it. Excessive alcohol, if you consume a lot of alcohol, it can also lead to ulcer. Then smoking is very detrimental. It causes ulcer. We also have stress. Stress causes ulcer. When I mean infection, there's a particular bacteria that causes ulcer. We have Helicobacter pylori. This is a particular bacteria that causes it. Then we also have the Zollinger-Ellison syndrome. The Zollinger-Ellison syndrome that also causes ulcer. This is a very rare case. It's not all the time that you find this type of cause of ulcer. When I mean Zollinger ulcer, I'm talking about a particular tumor that occurs in the digestive tract. Any tumor means excessive growth of the cell of that particular organ. So this is what brings about this type of ulcer, Zollinger-Ellison syndrome. Then we have the Crohn's disease. The Crohn's disease also causes ulcer. By Crohn's disease, I'm talking about inflammation, that is swelling of any of this part of the digestive tract. Any part of the digestive tract when it's being swelled up. So it also causes ulcer. There might be other type of other causes of ulcer, but these are the major causes of ulcer. Now, how do you notice that you have ulcer? How do you notice that you have ulcer? What are the symptoms? That to tell you that you have ulcer. There are a lot of symptoms, but there are common ones. We have the abdominal pain. Obviously, we start feeling pain in your abdomen. Then we have frequent vomiting, and we have nausea. Then there is blood that sometimes come out from your stool. Then there's bloating and gas anytime. Every time you have this. Then there is excessive weight loss. There's fatigue. There's loss of appetite. Then, like I said, there's blood in your stool. Sometimes you vomit what? Blood. These are what? Some of the symptoms that you normally use to know that if somebody or a patient is having what? Ulcer. Then, like I said, there is fatigue. You're always what? Tired. You're always what? Tired. Now, there are complications that comes from having ulcer. Yes, there are complications that come from what? Having ulcer. For instance, there's going to be a perforation, that is hole in your stomach or the intestine. When there's a hole in your stomach or intestine or any of the lining, that's one of the complications. Then we have what we call obstruction. So the digestive tract can be obstructed. Anything can block it up. Then we have, like I said, inflammation of the pancreas. There's a that is pancreatitis. That's the name of that problem. It swell up. The pancreas swell up. Then we also have sepsis. Sepsis is when the problem persists, that is bringing about in a way that is bringing to threaten the life of an individual. Then we have what we call bleeding, excessive what? Bleeding of that particular individual. So these are the implications that can arise from somebody suffering or having what? Ulcer. Now, how do you treat it, or how do you find out that you have ulcer? What are the ways that you diagnose that you have ulcer? Then there are various ways, and we have what we call endoscopy. We have upper GI series by using what we call there's an element known as barium. So when you swallow barium, actually it's like a sensor, a trigger, a tracer that tells that somebody have an ulcer. Then we also have blood tests. You can try to do a blood test to confirm Helicobacter pylori that I talked about. So it's kind of a blood test. Then you have stool tests. You can take the stool of that person and can test for it, for the presence of this particular bacteria that I mentioned. These are the way that you can test if somebody is having ulcer or not. These are the diagnostic way that a person can know if the person is having what? Ulcer or not. Then we'll talk about treatment. How do you treat about ulcer? How do you treat ulcer? Now, first of all, since like I said, one of the causes is a bacteria, so we can actually use antibiotics to treat it. Then we can also use acid reducing medication. Any medication that reduces the acid content can be used to treat it. Then we also have anti-ulcer medication, any compound that doesn't lead to causing of ulcer, like any sulfate compounds, any sulfate compound per se can also cause it. All right. Then we also have life-changing diet. You look at the type of diet that you eat. If you are the type that smoke, you stop smoking and reduces the consumption of what? Alcohol. Then you can also treat it by surgery. You can carry out surgery to look at the particular place where inflammation is, so that it can be corrected or treated. So in this, any of these ways can actually be used to treat it. There are other medications, but these are the common ways in which you can actually treat a particular ulcer. You can also use diet to control it. You check the type of food that you eat. Avoid spicy food or fatty food, or food that are rich in acids. Then we have eat smaller meals, don't eat large meals. Then prevent eat often, frequent eating. Then increase food that are rich in fiber. Drink a lot of water. Avoid alcohol. Avoid what? Alcohol. These are the ways you can actually do it using diet. But please, if you are suffering from ulcer and it's kind of severe, I will advise you consult your physician or your doctor to seek for professional advice. Thank you, and God bless.